So again, where do you apply the CBCT system in your digital workflow? You can use this when you are planning your implant treatment, orthodontic treatment, or some major oral surgeries. Major oral surgeries will require you to actually do some CBCT scanning so that you can get a 3D image of the facial structure of the patient to actually know where you are, to do the treatment planning efficiently. And then we have the intraoral scanning, the IOS, which again is actually the first set in terms of application. Remember, one thing is to know the names and the definitions and the applications, but you also need to know the sequence of application in a digital workflow. Okay, the sequence of application in a digital workflow is also very important that you understand and remember that. So I'm saying this because even though the intraoral scanners have not been presented first, remember that in a digital workflow, intraoral scanning will be the first thing. Okay, so once you do the intraoral scanning, again, handheld device capturing digital impressions of the mouth. So you can use this against the traditional impression taking procedure using the impression trays and ordinates and all of those mixtures that you can use to take impression, which is not very pleasant to the patient. So the use of intraoral scanners eliminates all of those difficulties and unpleasant situations for the patient. Again, that is not to say there are no ups and downs to it. There are pros and cons to the use of intraoral scanners, which we saw yesterday, and we had done that previously as well. So the 3D printing, we've talked about it. We've talked about the visual articulators, digital smile design, where you can design the smile of a patient in terms of aesthetic dentistry, and then the patient can be able to visualize. It's like when you want to send a document to a printer, you can preview the printing document, the document as though it has been printed, but it has not been printed yet. You are seeing what it will look like when it gets printed. So that means that you can either approve of the printing beforehand, or if there is something wrong, you can change it until you get a good output. So in a 3D smile design, you can do the same thing, design the smile of a patient and actually make the patient visualize what their new smile will look like, and then get their final approval before you proceed with the actual process of creating that smile for the patient. So the CAM milling, the CBCT guided implantology, the digital workflow, these are concepts that we talked about, and it's important that you understand and remember each one of them and what they stand for. Now, remember, we looked at generally the benefits of digital dentistry. So there are things I don't want you to be confused about. There are general overall benefits of digital dentistry, and again the limitations of the use limitations of digital dentistry, okay, as an overall benefit and overall limitations. Now, apart from that, we also did discuss and talk about the benefits and the limitations of each of these tools. Okay, so each of them have their own benefits and their own limitations. Now, based on the application, so in each application, you could be talking about benefits and limitations based on a particular application as well. So if someone is asking any questions, perhaps in exam or maybe in a conversation, you should be able to distinguish in your head which benefits relates to which limitation relates to which. Is it a general limitation or a specific limitation for a particular equipment? Okay. So we said that in terms of benefit, it enhances detection and diagnosis. It also helps in precision, in you it helps you to produce precise, superior fitting restoration. Okay, so the restoration that you get using digital tools can be more precise and fits very perfectly better than the one that is manually produced. There is enhancement in efficiency and convenience in terms of dental visits. It also makes the visit less frequent, so you can do more in one visit than you would have done if you were doing things traditionally. So those are some of the advantages and of general digital dentistry that we talked about. Again, we said that it's predictability in the outcome and the planning. So with the digital dentistry, you can actually predict the outcome of the work that you're about to do. For instance, if you are trying to place an implant and you are using a 3D printed mouth guide for your implant placement, you can place that implant with high level of precision. If you use a CBCT system, again, you can be able to identify the best place to position the implant, the best size of implant to use, and all of that. So these are some of the benefits of going digital in your practice. Again, like we said, depending on what level of practice that you are doing. Okay, so if you are not an implantologist in your clinic, or you are not an orthodontist, or you don't have an implantologist, you don't have orthodontic cases, you probably may not need some equipment, some digital tools. So if you have some funding to invest in the purchase of digital tools, you have to purchase the tools that are most useful and most needed for your system and for your workflow. So digital dentistry helps you to also have it helps you to have more control over your own workflow. Okay, it helps you to have more control over your workflow. Then we looked at the evolution of digital dentistry. Again, please be attentive to these milestone dates. Okay, when you are studying, try to remember these milestones: 1970, 1980, 1990s. Okay, what is the evolution of digital dentistry? So the early concepts in the 1970s, the first CAD/CAM system in the 1980s, the wider adoption of the system in the 1990s. In the 2000s, we started having digital imaging and impressions. Around 2010, 3D printing and digital workflow became popular. Around 2020, we started integrating AI and advanced integration of algorithmic technologies and all of that. So please remember, again, it's important that you can be able to compare and contrast between traditional workflow and digital workflow at any stage of dental practice. So this is not just about dental technology work. At any stage of dental practice, you should be able to remember and distinguish between the traditional workflow and the digital workflow. Or let's say, for instance, you have a scenario. Okay, if I give you a scenario where I'm presenting a particular patient, so this could be a critical thinking kind of question where a patient is described with the case history of that patient, and you are asked to describe the digital workflow to resolve the patient's problem, where you will be mentioning which equipment you are going to require, when you will require it, at which stage will you be requiring those equipment, and how would that differ from the traditional workflow if you were to manage that patient traditionally. Okay, so please think about the critical thinking aspect of this, because we're going to have case studies. I'll be presenting you with some case studies that you will use to actually analyze a patient case to know what to do in terms of the use of digital tools. So I did present for you a table of workflow comparison between digital and traditional workflows. Okay, so at the stage of traditional impression taking, if you are going digital, what you will be doing is intraoral scanning. In the area of manufacturing or manual workshop in the clinic, you will be doing you'll be doing the CAD design, that is the computer aided design, in the maybe in the dental office, okay, as opposed to the waxing up stage of a dental technology work. Then in-office milling against lab milling, where you now have to do all the curing and everything and all the finishing. Okay, so this was our introduction to the module digital dentistry, and that has lasted longer than it should. So what I'm going to do now is to get the second presentation. So the next thing we did was to look at advantages and limitations of the core technologies in digital dentistry. So at this stage, we started